The government says 30 is normal. My mom had a vitamin D level of 31, and she was still falling. So I got a level up to the 50s and 60s, and she stopped falling, stopped having to go to the emergency room, no x-rays, not on chronic pain medications. So you can cut healthcare costs on elderly patients just by upping their vitamin D level. They're less likely to fall. So this is the Matthews-Danner-Amiat graph that we designed. Basically, we challenged the government's level of 30 nanograms per milliliter being normal vitamin D level. And the reason that we challenged this level was because this first inflection point, this is 13 nanograms per milliliter. And so at 13 nanograms per milliliter, the blood level of vitamin D, we noticed that in the trauma patients, we started having a lot of deaths when vitamin D level got to 13. So the mortality rate increased from all causes, whether it's a heart attack, stroke, sepsis, pneumonia, whatever. So when they have low vitamin D levels, remember they can't stimulate their immune response systems. They can't regulate their T cell CD4 count. So even in spite of their own antibiotics, they start succumbing to all different types of sepsis infection. The second inflection point that you see here is 26 nanograms per milliliter. After we got above 26, we had 0 deaths. We've had 0 deaths in our ICU the past 5-6 years when people's vitamin D level got above 26. So when the vitamin D level started falling from 26 down, the amount of deaths increased. So the government says 30 is normal. 26 is too close to 30 to me, because the first 24 hours, your vitamin D level falls 50% in the hospital. So to me, that tells me I should be a little higher than 30. The third inflection point that you see here is 40 nanograms per milliliter. That's an important biochemical point. At 40 nanograms per milliliter, you get maximum bone density. So ladies with osteoporosis should therefore have a vitamin D level higher than 40 nanograms per milliliter, because you only get maximum bone density at 40. You're not going to get maximum bone density at 30. Also at 40, you get maximum muscle contraction, or your muscles get stronger. So that's very important in athletes. So if I can learn to manipulate that, I can make my athletes run faster, jump higher, get less fatigue, and be able to withstand more injury and heal faster. So also at 40, you get nadir or your PTH. So as your vitamin D level goes up, your PTH level comes down, so it nadirs at about 40. So you have 3 important things that go on at 40. So if vitamin D of 30 is what the government is saying, there are too many things above 30 going on at 40. Then at 50, you get maximal suppression of your chronic inflammatory response. So at 50, your interleukin-6, tumor necrotic factor, C-reactive protein starts going down. Also, your T cells get stimulated, so you got more T cells. So therefore, 30 cannot be normal, because you still got a lot of physiologic things going on at 40 and 50.